Hi, Dr. Michael Enns here to give you some information to help understand advanced testing. Advanced testing when it comes to cholesterol evaluation and management involves a number of tests that help decide if you're at risk for heart disease. Now, the reason I'm doing this video is many people want to understand, what is this all about? Why do I need it? What about just a plain lipid panel or cholesterol panel that we get? Isn't that sufficient enough? And the reason it's not sufficient enough for a large number of people is that about half people who have heart attacks actually would have been told their cholesterol, their risk for heart disease, wouldn't even have been recommended for medication or treatment based on standard or traditional risk assessments. So there's a big need to evaluate for more. So if you're content with saying, well, I don't know, I'm fine with being 50% accurate, but for me, I don't want to be 50% accurate. So what it comes down to is there's a couple big categories of testing. There's laboratory testing and then there's imaging testing. I'm going to talk first about laboratory testing. The regular lipid panel measures what we call the total cholesterol, which encompasses triglycerides, which is part of the bad cholesterol, LDL, or low-density lipoprotein. It's a type of protein that carries the bad cholesterol. It's given a calculated, it's called an LDL-C, which is a calculated measure of how much cholesterol is being carried. And then it's called the HDL, or high-density lipoprotein. Some people call it the happy cholesterol, but it measures, in a sense, the good cholesterol, which tends to lower the risk of heart disease. Problem with this is that the proteins that carry the cholesterol, the low-density lipoprotein, for example, is calculated. What happens is cholesterol is carried, in a sense, or transported by these proteins. They can be small particles or bigger particles. It turns out that the absolute number of these particles, LDL particles, is the bigger predictor of disease than the absolute amount of cholesterol being carried. People who have characteristics of the metabolic syndrome tend to package the cholesterol in much smaller, dense particles than would predict. Because they're smaller, they need more of them, and then there's a total difference in number, and I've talked on other videos about this. That's one reason why we get the advanced testing. There also you can look at measuring through an antibody test the actual protein called ApoB that carries them. That's also very helpful, and I'll do that often. I like to get with the NMR lipoprofile assessing risk, because you can, I believe, get a little better accurate measure, but both are very good. A lot of studies have been done with ApoB. Sometimes when the particle concentration and particle size is very small, the ApoB may not pick up that, but that's cutting hairs to a degree. Another good measure of that is looking at, we call it the non-HDL cholesterol, is taking the total cholesterol, take away the bad cholesterol, the HDL, and looking at using that number, and that's actually more accurate than the LDL-C, or as accurate, and is preferred over the regular LDL-C panel. The other factors, when we say, well, what about, should everybody get this NMR lipoprofile? Well, cost is the biggest issue. If it's not covered by insurance, it tends to cost somewhat more. If insurance is covered, I think it's a good assessment. But being economical in these times, should we get it for everybody? Well, tell some characteristics of people that we should strongly consider getting it in is if you have any of the 5 characteristics of metabolic syndrome, and the 5 characteristics are having a blood pressure 130/85. Now, if you already have high blood pressure and you're being treated and it's under that, well, that counts. If you have, for men, a waist circumference over 40 inches, and again, this isn't where you wear your pants, but it's actually measured an inch above your waistline, parallel to the floor, and we measure that in the clinic here as part of our vital signs. If there's an HDL that's less than 40 for men, waist circumference for women if it's over 35 inches. And then for the HDL for women, if it's less than 50, is considered risk factor. Triglyceride level, if it's greater than 100, is considered a risk factor. Greater than 150 is considered one of the metabolic syndrome criteria. Many would argue if you get really into 100 or higher, that makes me nervous. A blood glucose level of fasting of 100 or greater also is one of the risk factors or criteria for metabolic syndrome. So if you have any of those, that's a strong consideration to get the NMR lipo profile. If you have all 5 of them, much higher risk for heart disease and also much higher risk of having these small dense LDL particles. Another testing that we do commonly is called, that we can use for assessing from a laboratory standpoint, is called an HSCRP. It stands for high sensitivity C-reactive protein. It's a marker of inflammation and has been shown to add to the evaluation of risk. In the lining of the arteries, if there's plaque that's been going on in white blood cells that have gobbled these up, they can be swollen, cause inflammation, irritation to the lining of the artery. There's a protein that these can trigger the release of a protein through the liver called a C-reactive protein, and we can measure that in the lab test. HS stands for high sensitivity. It measures small amounts or levels of this that can pick up with heart risk. Next, there's also called an LP-PLA2, or plaque test, that measures an enzyme that also is more specific for plaque. HSCRP can be elevated for other reasons, such as autoimmune diseases or infections that can raise the C-reactive protein level as well. There's also a protein called a lipoprotein A. This is a protein that detaches the small dense LDL particles that facilitates transfer of the LDL particles through the lining of the artery. It also inhibits or can block formation of the plaque or clot if it forms, or can prevent the breakdown of clot if it forms in the event of a heart attack. When do we get this? Well, if there's a strong family history of heart disease and you don't have, if you're already not at high risk, it'd be a strong consideration to get this. It's completely genetic. You only have to get it once, and we don't follow it over time. So that's another thing. This also can be helpful if there runs in the family. You have this. Hey, you want to have your kids, or you make your brothers, sisters, other family members, make sure they get checked as well. So those are some of the more common blood tests that we can get to help get a more detailed assessment. When it comes to other testing for advanced testing for evaluation and risk of heart disease, is looking at, we call it CIMT, or carotid intermedial thickness testing. Measures the thickness in the lining of the artery. It's like a window into the heart. We know that there's a connection if there's plaque here that increases somebody's risk for heart disease. Also, they can do heart scans and looking at the chest to see if there's calcium deposits in the arteries of the heart. Usually don't really strongly look at getting this under age 40 for men or women. CIMT probably is a little bit better for women in middle age versus the heart scan. Also, you don't have the radiation risk. Radiation exposure is very low. There's been different recommendations on this, but for people who are what we call intermediate risk, you're not at very low risk, but in the middle. Most have said that's good. Some have said even if you're at low risk, hey, use that as an assessment. Different opinions on that, and it's something I recommend talking with your physician about. And then also, if you're already at very high risk, getting a heart scan or measuring plaque in the arteries is not going to add any other information. So I use it sometimes to help give us some more information. Sometimes use it in a sense as a tiebreaker. Hopefully this helped to give you a better understanding of what's going on so you can make better informed decisions about advanced testing and understand this more. If you have any other questions, feel free to contact me or set up an appointment for more information.